Well, we're here with Dr. Beck, a medical doctor and a nerve specialist and a, physical therapist, in his practice, all kinds of things from Huntsville, Alabama. Dr. Beck, let me ask you a question. A person who has a personal injury, maybe even a workman's comp injury or something, but a personal injury, one way or the other way, he is injured. What does it take for him in order to be getting well as to get paid by the insurances and maybe even being compensated more, money for pain and stuff? What are some of the important issues there which patients quite often, or victims in this case sometimes, really don't realize, and by doing so they don't get paid, and perhaps even more importantly, they don't get well, because if they don't get paid, they don't get treatment. What is important there, and how do you handle that subject and actually get great results?
Well, that's a great question. One of the biggest problems I see in personal injury cases is lack of documentation. And documentation involves several things. One is showing the insurance company and the people involved in the case exactly what the problem is. And to do that, you have to do a very thorough physical examination, document your findings, document your treatment plan, and document your expectations for that treatment plan. So once you know what's going on with the patient, then you can tell the insurance company what you're going to do and how long you expect it to take to get the patient better.
Now, I've known, lots of doctors across the country and all kinds of varieties of doctors, and it seems to be that literally some doctors, some practices, they get more and easier results. I've seen patients who would go to 2 or 3 doctors, maybe a chiropractor, maybe a physical therapist, maybe an MD, a pain management doctor, and to a certain degree, everything I talk about more or less is under your roof now. But what I've often seen is the chiropractor, and I love chiropractors, and my wife goes to them all the time, and she swears by it and all that stuff. And but I have quite often seen that many of those practices, yes, they can cure you, but they cannot prove to the insurance why X amount of treatment is needed, because they don't have what the insurance calls scientific backup. Rather than, your fifth spine is, your fifth vertebrae is out, blah, 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 is this or that. All fine and dandy, an X-ray might even show it, but it looks like insurance companies need and want more. And if you look at all the abuse which is going on by patients, by doctors, by everybody, and some abuse is just not abuse by intention, but just like, we all waste money, so we just waste money. It's understandable that insurance companies look for good advice, because number one, it costs them money, and number two, if the treatment isn't needed, it not only costs money, it just may not do anything to the patient. So how do you help out there? What are some of the tests you are doing which can prove to the insurance company that this is needed, and perhaps more importantly, gets the patient really on the right direction without any VIAs?
Well, the first thing to do that I find people don't do, particularly in my profession, is a thorough physical examination, documenting exactly what you see wrong with the patient in terms of loss of range of motion, nerve problems, nerve deficits, loss of sensation. There's a problem. If they treatment for the problem. And so that's the big thing that I think is really important. Now, once I find a problem on my physical examination, then we can move on to doing things like nerve testing to prove that there is nerve damage or ongoing nerve problems that, again, need treatment. So once you show the insurance company there's a problem, then they can understand why you need to treat it or why you need to order further tests or treatment for that patient. And as a specialist in musculoskeletal medicine, that is, I treat people with muscle, joint, and nerve problems. We can handle a variety of conditions that come out of personal injury cases, particularly those that you see in situations like motor vehicle accidents where people have whiplash, neck and back problems, and musculoskeletal pain.
So it sounds to me that the nerve testing it is a big one. And I've heard many, many times that on nerve testing, it does a couple of things. It really shows you where it is, where the problem is, because obviously you doctors know which nerve does what, where, and when, and which nerve influences what. And just like today, no doctor anymore just pokes your shoulder and says, I think you have a lung infection. It's just not how we examine anymore.
No.
A doctor doing that would go to jail, I assume. And
maybe.
maybe. Well, you get the point. You know, we're trying to be funny here at the same time. But I mean, that's how I still was examined. Do you understand? My dentist examined whether I have a toothache or what tooth is wrong by turning his mirror around, and with that steel metal handle of the mirror, he would poke every one of my tooth. And when I was jumping, because he poked on it, he would say, that's the tooth which needs to go out. That's not how we do examinations anymore. So the nerve one, number one, shows really where it is. And at the same token, if it shows you whether it's a big system, because a nerve problem can be very big and very systemic and unrepairable after a while. Am I right there?
Absolutely. For example, if I have numbness in my hand after a car wreck, that can come from three different things. It could be from carpal tunnel, it could be from a pinched nerve in my neck, or it could be from a muscle spasm. Now, obviously, the treatment for those three conditions is all very different. So if you don't know exactly what's causing that numbness in your hand, by doing a good physical examination, by doing nerve testing, then you could be spending a lot of money and a lot of time treating the wrong thing.
Right. So the nerve test, it zooms it in. It's like laser precise zooming in. It doesn't do the treatment, but it makes sure where to operate. You know, again, that's why we have all the three-dimensional X-rays these days and whatever, that, you know, the big CAT scans, and so that we 100% know where what is. Because very obviously, if a person's neck is hurting, it doesn't mean that his neck needs treatment. It may be in the lower back. It may be somewhere else, and whichever way it is connected. And the nerve testing will really show that. And if nothing shows, then we know that, okay, it's more the muscles, it's more this, and and even the patient knows, it's not as alarming. This will probably go away because it's not fundamental. And I can see why insurances, by having those tests, go, this guy needs treatment. And on top, you see what I'm saying? I can see that. Yeah. Well, Dr. Beck, thank you very much for enlightenment. It's very, very good. It shows me why, as I said, I know so many doctors who seem to be almost like salespeople. You know, some salespeople can't sell anybody anything. Some salespeople sell everybody anything. And I'm not saying screwing them over. I'm just saying that people buy with pleasure. Well, it usually means that you enlightened your prospect that this is good for him. Then he doesn't feel like he got sold. He feels like he's buying. So if you give the right tests to the patients and the insurance company, the patient gets well, which the insurance company does want that. They don't want to support the guy forever.
Yeah, absolutely.
On unimportant. They just want to make sure that they have the right treatment, and that's why the right tests. And so you need to go to a guy with all the guns. With all the medical instruments. Thank you very much, Dr. Beck.
Thank you.